Hello, everyone, and welcome back to our discussions about change and leadership. This week, we will be discussing from evidence to innovation, how we can measure what our practice is and where change should occur. So let's take a look at what we'll be discussing. Some things that we need to look at for change is probably first and foremost is cost. You quite well understand that healthcare is becoming more expensive practically daily. So how can we make the costs less but still keep quality of care? Such a fine line. Cost shifting. Is there any way that we can shift costs away from the patient and to other areas? Is there some other way to cost shift? So that's something to look at, how we can make a change. How do we meet the demand without accountability? Well, I feel that everything that we address in healthcare has to have some accountability, but it doesn't have to be for everything. And then where are we doing only a partial measurement of the care that we're providing, and it's only given us half the story or half the information that we're wanting to. So where can we make measurement improvements to help us make the appropriate changes? And then we always have to use evidence to support change. It's not an optional indicator. We have to use evidence, and a good leader will always use evidence. So some points to ponder when we're looking at change. How much are we willing to spend on healthcare as a country? I know not each one of you can make that decision, but how can you work in your professional organization to drive some of those thoughts and provide help to get answers? Is cost shifting between and among payers of healthcare acceptable? Do we make cost shifts between Medicare and Medicaid, Medicare and private insurance? What's the best mix? Is there? That's always something that we have to be constantly addressing. Do individuals have an obligation to practice healthy behaviors? This is something that's been going on for decades, actually, but I think we're at the point where we have to start looking at that. How can we help individuals make more healthy choices and help them to be more active in maintaining their health? So how do we do that? Can we do it all the time? I don't know. We all need to look at how to answer that question. Should outcome evaluations for patient care require provider-patient evaluations? To me, that's something that is constantly needing to be addressed. I've noticed that a lot of satisfaction surveys are down to maybe 3 questions at the most. Are they capturing the information that we need to know that we're providing the appropriate care to our patients? We don't want to get into a situation that only the very happy people are providing evaluations or the very disgruntled. We need to find that happy mix in there. And can we expect always to have the best evidence to provide a measure of change and care that we provide? So these are some of the areas that are constantly need to be looked at in order to see where a change can occur and how we can do it. So there, you know as well as I do that the healthcare system is quite complex. All events, there's connectivity because all individuals and activities are linked in some way. We're not providing care to our patients in isolation, nor is the patient and family receiving information in isolation. Everyone has to be working together. And again, this builds on the interdependence. Again, we're not working in isolation. We have to be interdependent on a lot of other healthcare providers, be it physical therapy, physicians, physician assistants, all of these departments, labs, surgery, all of them. And there's always going to be an unanticipated and unpredictable events. So we have to be able to recognize and do that to help sustain progress. So we've done a lot of healthcare measurements in the past. There's traditional metrics like the patient satisfaction survey, looked at teamwork effectiveness, patient provider engagement, degree of evidence integration. That's where we need to be looking at, and are we capturing the data we need in order to support change? So the new healthcare evaluation model is looking at ways to document the story of the healthcare experience. What are the variables that we need to consider to capture data on so we can make a sound change? What traditional tools can we manage to see the complexity of the healthcare system? What can we use? How do we manage all that information that we get? Can we quantify the value of teamwork? How do we do that without looking at satisfaction? This is the direction that we need to be taking as really engaged leaders. We need to focus on in the engagement of providers and patients, in being able to focus on the patient's needs and outcomes. We have to, if we're going to make changes, have to do it in a logical manner. We have to do it at a local level and then be able to expand it. I think that's what's been a lot of the problems in previous ways to make change, like changes with Medicare at the federal level, and then it drives down to the local level. How can we reverse that so that we can gather data to make change and then make a true change at the federal level, like Medicare, I'm sorry. We always have to plan for course corrections. Change will never occur in a smooth, organized manner. There's always going to be something unexpected that occurs. We have to understand how we can weed through large data sets to get the appropriate information that we need. And we need to see the complexity, look at the complexity in a new way. Now, your book talks about considering new roles such as the chief data officer. I think that might not be a bad idea because there is so much data out there that we can collect, but how do we get it into an organized manner that a leader can look at the data that's appropriate to use? We have to look at healthcare as a business. Again, documenting the healthcare narrative. What is going on in healthcare that can look at it more in a business model. I know everybody gets upset about that, but we're looking at innovative ways to change costs, to cost shift, to make changes appropriate that are quantified. So we really are looking at a business aspect of making change. We always have to identify risks and to eliminate or mediate the risks as much as possible. The healthcare system has to look at profit and loss across a timeline. A hospital has to continue to function in where they do have monies to continue to provide care. So all of these things listed have to be looked at, and it really does come down to using a business type model. So I hope that you have learned something from this. I hope that it has helped you to identify some of the areas of change. And I hope this will just help you with your discussion board this week. Thanks for listening and have a great day.